Hi, everyone. We're so excited to have you here. My name is Mariana. I am one of the aesthetic specialists here with Revive Med Spa, and I have our nurse practitioner, Susan, Senior Director of Clinical Operations. Hi, I'm so
Hi,
excited to have you here today.
thank you. Happy to be here.
Yes, we're so excited. This is my first time hosting a webinar, so I'm really, really excited, but please bear with me if I trip over my words, but so happy to be here. Today we're
She's
gonna,
perfect.
you're so sweet, thank you. We'll give it a few minutes to let everyone join in, but just an overview of what we're gonna be talking about. We're gonna be focusing on regenerative treatments. What does regenerative mean? What are the different options that we have to carry? Who's a candidate for which one? We're going to be talking about all the fun little details of everything. So you'll be learning a lot today. I'm going to be learning along with you. This is all fairly new to Revive, so I'm really excited, as you are as well. Please feel free to, as we're going, introduce yourselves in the chat. Let me know what you're interested about learning today, what you're most excited about. And as we're going through, feel free to put in any questions that you have as well. We'll be dedicating some time towards the end for Q&A, and we'll get to as many questions as we can. And hopefully we'll be able to answer a lot of your questions as well along the way. So a little bit about what we're covering today. We'll be talking about a little bit of Revive. You know, if you are new to the area, if you're new to us, you'll learn a little bit about who we are, our team. We'll then go into the different collagen treatments that we have available. Again, the Q&A, and then a little bit about how you can get in touch with us. So a little bit about who we are. So Revive is one of the leading med spas in California. We've been around since 2006. So we're going on 18 years now, which is incredible. Time flies when you're having fun. We are the number one provider of a lot of different treatments. We're number one for Botox, the entire Juvederm line of fillers, which includes Voluma, Velour, Volbella. We're also number one for Kybella, Latisse, Skin Medica, Cool Sculpting, and just recently we were announced number one for Morpheus as well in the state of California, and for Morpheus we're number two on the West Coast. So if you're not familiar with those treatments that I just mentioned, a lot of incredible treatments too, but you can always do a consultation with us to talk about those. So a little bit more about us. This is our team of clinical directors, which includes Dr. Vish Verma, who is our co-founder. He oversees the San Diego area. Dr. Leaf Rogers oversees LA, and Dr. Cam Rappaport oversees the Bay Area. So their main purpose is to really support our clinical team and provide them with all the tools and education that they need. But Susan, nurse practitioner, Senior Director of Clinical Operations, I'm so honored to have you here today. Thank you for taking the time. Why don't you tell us a little bit about who you are?
Sure, yeah. Well, I'm a nurse practitioner. I've been doing aesthetic treatments for injecting for about 15 years and over 10 with Revive. So I've grown with Revive. I just love this group. We have an incredible group of providers here. I oversee our providers. We have about 60 scattered throughout California. It's just an excellent team. And I'm thrilled to be here to talk about regenerative aesthetics.
We're so happy to have her. I always say Susan is like our Revive fairy godmother. She is incredible. I'm so happy to be able to work alongside her. She is, yes, yes, she is a wealth of knowledge. So again, we're so happy to be able to pick her brain today and learn about all the treatments that we're talking about today. So it's so exciting. And a little bit about me. Again, my name is Mariana. I am one of the aesthetic specialists. I have been with Revive for about 4 years now, and I'm also a licensed esthetician. My role here is to pair our clients with the treatments that we have to offer, and I'm also certified in paramedical aesthetics. So this world has been a passion of mine for a long time, and I'm so happy to be here at Revive to deliver my tools to our clients. Yeah. So again, today our main focus is regenerative treatment. So Susan, why don't you tell us about what does regenerative mean?
Sure. So regenerative aesthetics, these treatments actually help improve skin quality, skin laxity, volumization, but it does this over time, harnessing our own body's biomolecules, our own growth factors and stem cells to regenerate and rejuvenate. So this is the trend in our industry. It's coming from Europe, and it's become more, these treatments have become more and more popular. There's still always a place for filler, where you get that immediate gratification. But many individuals prefer a more gradual, natural type treatment. So we are going to be talking about a number of our regenerative treatments today, including Sculptra, Radiesse, and Renuva.
Yeah. And so I feel like it's all about aging gracefully, right? And so these are one of the tools in our tool belt to allow us to look our best as we go through life. So who is a good candidate for regenerative treatments as a whole?
Yeah, well, we don't produce as much collagen starting at the age of maybe 25, at 1% less per year. So really, even in your 20s, some of these treatments are fabulous, just to help maintain and to help stimulate that collagen, so that you don't have more concerning issues later with laxity and volume.
Because not only are we not producing as much, but also the amount that we have is being broken down too.
Absolutely.
So it's kind of replacing it as you go as well.
There are intrinsic factors like age and extrinsic factors like sun damage and pollution that affect that cell degradation.
And we're going to be talking a lot today about, collagen and elastin stimulation. So maybe a little bit on what the difference is between collagen and elastin, would you say? Like collagen's plumping the skin.
They all work together, and elastin focuses on wound repair. But with Sculptra.
So let's talk about Sculptra. So this is one of our OG treatments. We've been carrying it a long time. It's very popular. Why don't you tell us a little bit about what Sculptra is?
Yeah, sure. And Sculptra's been around for a while. It was discovered in dissolvable sutures that when they broke down, your body would regenerate that collagen growth. And Sculptra it's been used for many, many years in the medical field. Used aesthetically, it was FDA approved in the early 90s for the treatment of AIDS patients because of their wasting, and insurance companies actually paid for it. So it was quickly adapted in our industry for full facial rejuvenation. And it's actually, there's been an uptick in Sculptra over the past few years because this re-interest in regenerative aesthetics. It was kind of slowed down when Voluma came on the market in 2013 because people were drawn to that immediate gratification. It's now become even more popular because of this increasing interest.
And Sculptra also really helps improve the skin quality, right? It gives you like a radiance and a glow.
Absolutely. You get that Sculptra glow. People love that Sculptra glow.
We love that.
Oh, and this is actually one of my patients. And it's really hard to get this before and after because not only, of course, it requires a patient consent, but this is 6 months apart. And this is one treatment of Sculptra in the booty. One treatment, 10 vials is used for one treatment. And it may take 2 to 3 treatments depending on what your overall goals are. But this will last a minimum 2 years. Studies were conducted up to 2 years so that we could say that, but we've seen it last actually quite a bit longer.
Those are amazing results just after one treatment. That is incredible. Amazing. That's so exciting. And it's specifically with the butt lift, if this is something you're interested in, we do have special pricing when it comes to the Sculptra butt lift. Like she mentioned, it's a minimum of 10 vials. So we have a special pricing on that package. And we're also offering, it's for $500 off right now of that as well too. So that's exciting. Amazing. And then, so this is another one of your clients, from what I
this is one of my patients as well. And she just wanted more conservative treatment over time. So it was like 2 to 3 years. We injected 7 vials. So one of the guideline that we use is 1 vial per decade of life. So in her case, she's in her 70s. And so that was injected over a period of 2 to 3 years. And you could see the quality of her skin really improved, as well as it revolumized her mid-face and temples. And she just looks so much younger.
Yeah.
Um, mhm.
What I love about this treatment is that going back to that more natural approach, it's one of those things that once you get it done, people know you look better, but they don't know
Yes,
why. They
exactly.
just know you look rested,
Yeah.
you look hydrated, you look radiant. So it's really, really nice. And like she mentioned, the 7 vials, you do them with time. So it's really a collaborative approach with your injector. And you kind of go along the way of what you're wanting to do and how many you're needing. It's a journey, but it's a really fun journey.
Yeah.
Yeah.
And that's not a strict guideline.
Right.
It really, as you mentioned, is
Right.
individual and depends on how much sun damage and what your age is and your anatomy.
Right, right. Yeah,
Yeah.
your starting point and your
Yep.
end goal.
Absolutely.
So let's move on to the next treatment, which is Radiesse. And from what I understand, it's kind of similar, but kind of different, right? So why don't you tell us a little bit about Radiesse?
So Radiesse is another collagen stimulator. It also does a really good job stimulating elastin, which is that bounce back. So Radiesse is the chemical name is calcium hydroxyapatite. It is it's in a gel carrier that's comprised of carboxymethylcellulose, which is, I know, a little TMI, but it's that carboxymethylcellulose that gives a little bit of immediate improvement. And then as that breaks down, the calcium hydroxyapatite contains all those proteins and the goodies that help actually repair tissue and improve that skin quality. And we use Radiesse. We inject it in the face in a dilute form. We also inject it in a dilute form in the hands, and then hyper dilute for the neck and décolletage. I've had it injected in my neck, and it's like a wash. It gives you a really nice, kind of cleans it up and helps with that crepiness. We also inject it in a hyperdilute form in the arms for that crepey skin, and helps tighten a little bit, and also the knees and the thighs. Yeah. So typically 2 to 3 treatments are recommended, followed by maintenance maybe once a year.
That's incredible. And I talk to a lot of clients where, like she mentioned, the arms, with age, with gravity, with friction, they start to get a little crepey. So it's nice to know that there are options that can help improve that. That's amazing. And it sounds like with all of these treatments, it's like the gift that keeps on giving, right?
Absolutely.
Patience is the name of the game, and it just gets better with time.
Right.
Yeah.
And there's some overlapping qualities between Sculptra and Radiesse. There are certain treatments that I prefer for certain body parts on certain individuals. It really requires a consultation with your provider.
Yes, perfect. All right. And then I think we're going on to some before and afters for Radiesse. So this is a client that had Radiesse.
Yes, in her mid-face as well as her neck. And you could look at the improvement in the submental area right under her chin. That was really bothering her, and it really helped tighten that up. So that's just a beautiful result and very natural looking.
Yeah, she got incredible results. And then you've mentioned the hands a couple times. This is an example of that. Amazing.
Yes, and you see volume as well.
Yeah, yeah. I mean, just they look 10 years younger, if not more. That's amazing. And this is, again, it's all a matter of that consultation with your provider and how many you would need and what the right treatment is for you. But they're the experts here, right? And they're here to guide you and pair you with the right treatment that's going to give you results similar to these. So that's really, really amazing. And then so before and after on the arms. So going back to how you mentioned that it helps with crepiness and texture.
Exactly. And that I know some might ask how many syringes is required for the arms. 1 or 2 syringes per arm is typical
Okay.
for each treatment.
Okay. Okay. Nice. Yeah. And then you just kind of, again, have that collaborative effort with your injector and touch base once the results have peaked and kind of determine if you're needing more or what the next
Absolutely.
course of action is. That's amazing. That's really incredible to know
Yeah.
that we have that option for those areas. And you mentioned above the knees too is another area.
Yeah, and it's
That's really
usually
nice.
the thighs.
Yeah.
So it's not just around the knees, but you
Yeah.
actually want to treat going up the thigh a little
Yeah.
bit.
It's
Mhm.
that gravity, right? Don't we love her? We love it. Oh man. All right. And then last but not least, Renuva. So this is a little bit
Oh
of a
boy.
different
Yeah.
approach, right?
This is an
Okay.
amazing treatment. It's remarkable because there's nothing else like this. It's like fat grafting, except it's in a syringe. So this is an adipose-derived matrix. When it is injected, it is replaced by your own body's fat cells. So you're like, okay, why do we need fat? Yeah, actually, because we have bone, muscle, breakdown, fat, like for instance, concave temples. So I often inject Renuva there and it replaces. So it is replaced by your own body's fat cells,
Yeah.
which last 7 to 10 years.
Yeah.
So we don't generate new fat cells after the age of our
Mhm.
mid 20s, let's say.
Right.
The mid face, the neck does a beautiful job in the neck. Hands,
Amazing.
the booty. I've done booty. Sometimes I
Yes.
blend it. I'll blend it with Sculptra, or I'll blend it with Radiesse at times to
Wow.
boost the results. It actually those treatments potentiate the Renuva, and it depends on the patient again.
Yeah.
So this is just revolutionary, and I'm so thrilled that we have this to offer.
Yeah, that is absolutely incredible. I didn't even know that replacing fat was a thing, but like you mentioned, it's almost like fat grafting, but you don't need to go under and you don't need
Right.
anesthesia.
And it finds its own vascular, actually, it
Yeah.
has its own vasculature because
Yeah.
it creates angiogenesis, new
Yeah.
blood vessel growth.
Right, right.
Mhm.
Yeah, and I think it's funny, like you mentioned, like who would have thought we would want more fat? But you know, on our face, we do have a lot of fat pads on our face that
Yeah.
naturally break down as we're
Yeah.
aging. And so this is nice to kind of help that process, essentially kind of reverse it, right? Or kind of replace it.
Yeah.
And again, just allowing you to age gracefully and always look your best, but in a natural approach.
And you can, this can be injected pretty much anywhere where fat cells live.
Yeah, yeah,
So
yeah.
I had um, my earlobes injected because,
Wow.
you know, the earrings start falling as our tissue
Yeah,
breaks
gravity
down.
again.
Yeah. I had my temples injected. So
Yeah, yeah, that's and I think probably a popular question a lot of you will have is, well, do I need Radiesse? Do I need Sculptra? Do I need Renuva? Do I need collagen or do I need fat? Again, that all goes back to that individualized consultation with your injector on what your end goals are, what your areas of concern are, and then they'll be able to guide you on which one is going to give you those results that you're looking for.
and one analogy is Renuva is like breasts, whereas the Sculptra or Radiesse is like the bra, the
Oh,
structure.
interesting.
Yeah.
Okay.
Mhm.
Okay. Amazing. So this is a before and after on Renuva. Incredible. She looks amazing. She looked incredible before, but after she looks 20 years younger.
Beautiful.
Yeah.
Beautiful results.
Amazing. Amazing. And you can see again, this is results over the course of 4 treatments. So again, it's that going back to that collaborative approach of you kind of just as you go decide what the next course of action is. Do you need more of this? Do you need more of that to get you those ideal optimal results?
Yeah, and Renuva, you'll start seeing improvement after about 2 months.
Okay.
80% improvement by about 16 weeks. By 6 months is that's as much as whatever was injected will
That's
show.
where they peak.
Yeah,
Okay.
exactly.
Okay.
And so you know, sometimes it depends on the consultation, but
Right.
sometimes there are a few treatments and then you reassess in 6 months.
Yeah, amazing. It's like I said, the gift that keeps on giving, right? So that we can age gracefully like a fine wine. Not like men, because men men age gracefully naturally. Here we need treatments like these and
Well,
experts like Susan.
our collagen breaks down faster than men's.
Men,
So
I can't. All right. So again, another picture on hands. So all these treatments, it seems like, can be done on the hands as well. Amazing. Okay. And so she got some nice improvement in the skin laxity, the volume, kind of just all of those irregularities that she had. And this is 3 months after the 3 treatments is what it looks like.
Yep.
Incredible. Absolutely amazing. And this is one of our injectors here at the Encinitas location. This is Heather. So she had a little bit of Renuva. Why don't you tell us a little bit about what she did here?
So Renuva was injected in her temples and her mid face. And this is just 3 months later. So she will continue seeing improvements. So you could already see the improvement, a very natural, beautiful, actually brighter, a little fuller.
Yeah, I actually was talking to her a little bit yesterday when I saw her picture was in here, and her temples really do look incredible. And I think the temples are a very common area where we tend to lose a little bit of volume and it tends to concave. And
Yeah.
hers looks so great. It makes me want to do it next.
Yeah.
That's
And your brow
amazing.
starts actually descending. So
Right.
yeah.
Kind of helps give you that illusion of a brow lift,
Yeah.
right? Okay, that's amazing. So, so good. Okay, so I see that a lot of you have been popping in here and putting in your questions. So I'm going to start from the top up. Any questions that are really specific? Again, we're going to go back to that individualized consultation with your provider, because a lot of it will have to do with your specific medical history, your medical chart, and it's such an individualized case by case answer that we wouldn't want to just give you a generic answer here.
So I'll go through some of the questions. And
Please, yeah.
So one of them is inquiring about whether it's safe to have Sculptra if you have an autoimmune disorder or other regenerative treatments. And this is something to talk with your provider about, because it depends. It depends if you're having flare-ups. It depends on your history and what type of autoimmune and all that. So that's something to discuss with your provider. Okay, let's see. How does the raffle work?
Everyone's entered into the raffle. So if you are here, you're entered into the raffle. And again, the winner will be announced via Instagram tomorrow, and you will also be getting an email letting you know that you won. But everyone's automatically included into the raffle. And then in terms of pricing, we'll be going over that here in a little bit too on the special pricing for the treatments. Yeah.
Okay, another question here. Where is Sculptra injected on the face? Well, it depends on where. We don't inject it under the eyes, but we inject it in the mid-face, the preauricular area, which is back in here. We inject it in the temples. We inject it in the nasolabial folds and around the marionettes.
A lot of different places. That's amazing. Yes, so everyone's entered into the raffle. So special pricing, again, we're going to talk about that here in a moment. Everyone has it. How long? So how long until you see full results from the initial visit? So again, it all goes back to it. It takes time, right?
Well, and also it depends on which treatment that we're doing. So Sculptra takes a little longer than the Radiesse. Sculptra, you'll see the Sculptra glow usually after like 2 to 4 weeks.
Okay.
But then it again depends on if you're looking for volume. And so that's really, slow over time. And by 6 months, right around 6 to 8 months is when you get the full result with Sculptra.
Yeah. Takes some time. Patience is the name of the game, right?
So with Radiesse, that's closer to 4 months.
Okay.
And it doesn't last quite as long as Sculptra.
Okay.
And then Renuva, we talked about how long that lasts, but you see results, and we reviewed that as well. 16 weeks, you'll see 80% of the results.
Yeah. And I think it's one of those things too, like if we think about it, it took time, right? It took years for our body to break down that collagen and break down that fat. And so even though sometimes we're like, oh, I have to wait 4 months, but it's worth it. And in 4 months, you could look your best. if I leave early, does this disqualify me from the raffle? I don't believe so. No, no, you'll be totally good. Again, we're just so happy that you joined us and that you're here and that you stayed as long as you could. So you're definitely still entered into the raffle.
So there's a question here asking what we suggest for a 40-year-old concerned with skin health, laxity, and slight jowling, Radiesse or Sculptra. Again, come and see a provider. We could probably use either, but it's best to see you in person so we can make that recommendation, tailored specific to you.
Yeah. And at the very end here, I'll talk about how you can reach out to us. We've talked a lot about making those consultations. So I'll let you know how you can reach out to our team to get yourself a consultation with an injector.
So a question here, I see it breaks down. I'm not sure what she's referring to, but quick question, does it require to be dissolved at all since it is a filler? The only one of these that is actually considered a filler is Radiesse, and we don't inject Radiesse other than in a dilute and a hyperdilute form. So these forms regenerate tissue. So they don't give you that immediate volume. So that would not be required.
Yeah, amazing. That's good to know. Let's see. Yes, you definitely still qualify. So Renuva is different than actual fat transfer. So yeah, I mean, I'll let you take that one. It's not an actual fat transfer, but I know we mentioned it's similar because a fat transfer, they're taking fat from somewhere else, they're putting it on the face, whereas here we're able to kind of.
It's an adipose derived matrix. So it's kind of like a honeycomb that when it's injected and it creates, it stimulates your own bodies. It actually recruits stem cells and then is replaced by your own body's fat cells.
Yeah. Yeah. I mean, we're like planting the seeds, right? And then we're letting the body do what it does best. How long in between treatments for Renuva?
Oh yeah, so that's a good question. And it really depends on the individual. If I know it's going to require more than a couple of treatments, because I'll only inject so much at any given time.
Right.
And so if there's no question in my mind that's going to take at least a few treatments, then I'll get those treatments, maybe do those about 8 weeks apart, and then maybe follow up 6 months later.
Yeah. Okay. Okay. Again, kind of playing it as we go. Renuva is awesome. It is. We're so excited to have it. Can you do Renuva after doing Sculptra?
Actually, you can, and I use them together. And what I want to say something about, someone mentioned, Renuva is awesome. We are one of the few med spas in San Diego that even carries this, offers this treatment. We are very fortunate to have Dr. Leif Rogers as our medical director in Los Angeles. He uses more Renuva than I believe anyone in the United States.
Wow.
So it was initially used, he's a plastic surgeon, initially used for some let's say post surgeries where there some corrections need to be made. And then it was started to be used cosmetically as we use it today. But he is one of their trainers, and he has trained our Revive providers. That's how I learned it. And we are very fortunate. We carry this. We offer this treatment because of Dr. Rogers.
Yes, that's incredible. And anyone that's new here, that's new to Revive, one thing that we really pride ourselves on is the fact that we do spend so much time on education and perfecting the skills of our injectors. And so I've been here for some of the trainings where Dr. Leif Rogers was here, and he was kind of passing on his expertise and his knowledge. So again, we're so happy and so lucky to have him. Who do we contact for a consultation? So you can give us a call, and again, all the information will be here in a couple of slides, and our team can get you connected with an injector that provides the service at the location that's closest to you. So we have 10 locations at the moment across all of California. We have an 11th coming on the way here. So wherever you are, there should be a location close to you, and then a provider will be the best one to give you that assessment.
Okay, so here's a question. Has Sculptra changed over the years? No, it's the same identical product that came out in the early 90s. Recommendations for dilution have changed over the years, but the product has not changed over the years.
Mm.
Would we inject Botox with these other procedures? 100%. We still need
Do
our
it all.
toxin.
Do it all while you're here.
So they work entirely differently. So neurotoxins act on the muscle. And, we just talked about these regenerative treatments. They help improve skin quality, laxity, and revolumize, but they don't act on the muscle. So they are completely different and they work synergistically.
Yes. Yeah. They're dynamic duo, right? It's a partnership. Any side effects? I mean, anytime we're injecting, right, there's always, I'll let you talk about that, but
Yeah, well, bruising and swelling are
yeah.
the main side effects.
Right, right.
And so you want to make sure that you're not taking blood thinners, anything that thins the blood, prior to your treatment, and following your treatment about a week or so
Maybe
prior.
skipping that glass of wine the night before. You can do it after to celebrate, but maybe just skip it the night before.
Let's see. And then recovery and downtime for each of these treatments. It's really they're insignificant. I mean, you might have some soreness. I know when my temples were injected with Renuva, I was a little sore.
Little tender, maybe.
Yeah, and I
Mhm.
took some Tylenol, which is fine. After a day or so, there was no discomfort at
Yeah.
all. I've not heard complaints about the butt lift. I know with Renuva, you don't want to sit on your booty for 24 hours, but
Okay.
really that's not bad when you consider
No.
surgical options.
Yeah.
It's pretty remarkable.
Yeah, that's amazing. With these treatments too, like facials or anything like that too, you probably wouldn't want to flush
Um,
your face down immediately when you leave.
yeah, not immediately,
Yeah.
but just a few days later,
Yeah.
that's fine.
Yeah, so it sounds like
Yeah,
downtime's fairly minimal.
yeah.
Yeah.
You're welcome. Someone said thank you.
Which one was
Oh, with the double chin. Okay, one individual asked here which treatment is best to help with a double chin. That is something we'd have to see you for, because they are not facelifts or neck lifts. So we have to see. I mean, you saw the before and after of the Radiesse patient. It really depends on how much improvement you're trying to get. We'd have to assess. So I hope that helps a little bit. Okay, natural. Go ahead.
so I think with it looking natural, I mean, that's what we pride ourselves on. Again, we are one of the leading med spas. And like she mentioned in the very beginning, we are all about making sure that you get your best results. And so even though we know, for example, Sculptra, a vial per decade of age, we would never do 4, 5, 6, 7 syringes in one day. We take it slow because
For the
this
face.
is for the right. I mean, for
right.
the booty be time. But my point is, we do try to take it slow because we want to make sure that you get the results that you're looking for. And also a lot of this does have to do with the injector has to be properly trained. And so that's what, again, go back to Revive. We're so happy. And so we pride ourselves on the fact that we spend so much time making sure that our injectors are at the top of the game. We have industry leaders within Revive. So you're in great hands here with us. Like Susan's had so many years of experience. It's can it be used
So no, none of these treatments are appropriate for above your lip. That I recommend laser resurfacing treatments for that area. A little neurotoxin can help in that area, but these treatments are not appropriate for above the lip. And then how often does Sculptra need to be injected and upkeep? Individual. It's an individual assessment. Again, we kind of use the guidelines, 1 vial per decade of life. And the reason we inject only 2 vials at a time is because one can only inject so much per square centimeter safely. So it's a safety issue. So we are take patients first,
Yeah.
safety first.
Safety first, always.
So, okay.
Filler versus what we've talked about. So Juvederm versus the treatments you've mentioned.
Well, the Juvederm, or any dermal filler is going to give you that immediate satisfaction. They don't improve skin quality and texture. They give you volume.
That's a big one. Yeah.
And they won't last quite as long. So, but I think it's there are certain areas where I might recommend using Voluma or Restylane Lift or RHA4 to give contour in the cheek, and then I might want to use Renuva for the preauricular area. So it's customizable.
Super customizable. Yeah, absolutely. But great question. Great question. And again, it all ties back to individual approach.
And then on average, I know here we're going back to the individual approach, but how many Sculptra vials are needed for the temples with Renuva and Sculptra? It's individual, but it depends on how concave the temples are. I might want to, if they're pretty concave, maybe a 3 cc syringe of Renuva with 1 vial of Sculptra. I'd blend that, inject it, and maybe wait about 16 weeks and to retreat. Consider retreating. Yeah.
Amazing.
Yeah.
Amazing. We've covered so much ground today. If you have any last minute questions, again, feel free to pop them in the chat. Really quickly, we can talk about the different promotions. I believe that's the next slide here. Oh, so okay. So to follow up, so you can follow us on Instagram, on TikTok, on Yelp. If you're a client of Revives, we love hearing how your experience was. So thank you again for being here. Thank you for taking time out of your day in the middle of what is it today? Wednesday, for being here. This will be recorded. So if there's anyone that you know that didn't get a chance to log in, we will be sharing the YouTube link for it and you can send it to anybody. Again, thank you, Susan, for being here.
Yeah, you're welcome.
Thank you so much. And we're so happy to see you maybe for the next one.